If you could prevent your own death or that of a loved one, would you choose to? When the COVID 19 pandemic hit, the world was forced into a lockdown at levels not seen since the Spanish flu pandemic of 1918, 100 years prior. As is often the case, when a situation is dangerous or difficult to understand, fear becomes a pervasive emotion. While the fear of contracting COVID and possibly dying was high, a significant number of people feared receiving the COVID vaccines themselves. Many felt the vaccine approval process had been rushed or that safety protocols had been sidestepped. There was also fear based on uncertainty about short and long term side effects from the vaccine. Included in that population were many healthcare providers, as reported by Anne Spinewine in the article Attitudes Towards COVID 19 Vaccination Among Hospital Staff. Even though there has been a lot of fear surrounding the vaccine, it has been proven that they are vital in curtailing the spread of COVID. As explained in a research article by Shilei Zhao, published in the journal Quantitative Biology, an aggressive vaccine protocol undertaken in Israel resulted in greater than 50% of the population being fully vaccinated by March 2021. This, in part, resulted in a measurable decrease in morbidity from COVID 19. Per Ronan Abel from the American Journal of Infection Control, in another study undertaken in Israel, the results show increased individual and herd immunity and that vaccinations show measurable decrease in deaths concurrent with increase in number of people vaccinated. Quote, "We have demonstrated that the real-world effects of a vaccination campaign are not necessarily simply the sum of expected efficacy multiplied over a population, but instead there is some synergistic effect similar to herd immunity." As a critical care paramedic myself working on the front lines during this pandemic, I witnessed firsthand the toll the disease took on our society in general, but also in more specific terms related to healthcare. There's the lack of basic medical supplies for everyone due to the overwhelming number of patients. There was competition and rationing of crucial medical equipment such as cardiac monitors and ventilators, based on the sometimes heartless process of triaging patients for their basic potential survivability. There's the issues of having to transport patients all over the country to find a qualified hospital bed that they could receive appropriate treatment, but also have no family support at the same time. There was the burnout of healthcare workers from being overworked in a dangerous environment in general, but more tragically, an increased disdain and or ambivalence towards some patients because they refused to get vaccinated for whatever reason, and now had become critically ill and were seeking help in an overwhelmed system that the staff partially blamed them for. As the research has shown, although hesitancies remain, it is of the utmost importance that people are vaccinated against the COVID 19 virus. Although non-pharmaceutical interventions such as wearing masks, distancing, and quarantining are helpful, COVID 19 vaccines have the highest measurable positive impact on individual and community morbidity. As colder weather approaches and more variants appear, our vigilance against the virus must remain steadfast. So, given everything I've told you today, I ask you again, if you had the ability to save your own life or that of a loved one, would you? Because you absolutely do have that ability. Please get vaccinated and stay up to date on your boosters. Thank you.